Okay, it's 2 o'clock. I'm going to go ahead and get us started. Welcome to the Texas Children in Nature Network webinar research update from the Center for Health and Nature with Dr. J. Maddock. My name is Sarah Coles, and I'm the Executive Director of the Texas Children in Nature Network, and we're excited to have you with us today. We are recording our session, and thank you for joining us. To save bandwidth for all of our attendees and for a clean recording, we ask everyone to turn off their cameras and mute themselves during the presentation. I will be monitoring the chat, so you can share your questions there, and I will share them with our presenters. Please remember to keep all comments in the chat kind. Jimena Vivanco is running tech for us today. Thank you, Jimena. We are recording the session, and Alice will share it in a follow-up email in the coming days. If you are uncomfortable with your name showing, you can change your name to anonymous and then private message Jimena with your name for our attendance. Also, if your Zoom name doesn't match the name you registered with, please change your name or let Jimena know. You can do that by hovering over your name and you'll see 3 little dots and you can change it there. If you are in need of a certificate and we do not have your name, we will not be able to provide you with a certificate. And just a reminder, if you're needing a certificate, you will need to follow the directions in the email that you got with this Zoom link. Now go ahead and do our land acknowledgement. Texas Children in Nature Network is headquartered in Austin, and as such is on the ancestral and unceded land of the Tonkawa, Comanche, and Sana people. Our ongoing colonial presence on indigenous lands compels us to take action now to counteract the effects of colonization. The work we do through the Texas Children in Nature Network is one small step towards that effort. And in just a minute, I'm going to put a few links about land acknowledgements and about those people groups in the chat. And I'd like to go ahead and welcome our speaker, Dr. J. Maddock with Texas A&M University. Thank you for presenting today. I'm going to let you take it away.
Awesome, thank you. Let me share my screen here. And I'm delighted to be here with everybody today to talk about some of the research that is coming out of our center in the last couple of years. It's really exciting. I think, if you're here in this webinar, you are a nature person and you're excited about the healing benefits of nature. And what's excited me is just how much there is to learn and how much we're learning about this. And so do want to recognize Natalia Rodriguez, who put these slides together with me. She's our project manager for the center and has been helping a lot in getting things together. Disclosure and support, I have no financial conflict of interest with this talk, but we have received a variety of groups funding us, including the Houston Methodist Research Institute, Texas A&M Health, REI Cooperative Action Fund, the Merrick Family, the Kinder Foundation, and others. For those of you who are not familiar with the Center for Health and Nature, we started back in 2018. We are a joint center that is joint owned between Houston Methodist, which is our top hospital in the state of Texas, Texas A&M, where I am based out of, and Texan by Nature, which is a conservation nonprofit founded by First Lady Laura Bush. And the goal of our center really is to drive research to study the impact of nature with evidence-based programs that complement the full continuum of healthcare from prevention, treatment, and recovery. And so in the last 6 years, we've really been taking a lot of look at how do we generate research and how do we really understand this human-nature connection better and how do we get people into nature. Of course, everything we go on follows E.O. Wilson's biophilia hypothesis, which says that there is an innate emotional connection between human beings and other living organisms. And really, as we know, a hypothesis is an idea. And so our job as scientists is to say, is E.O. Wilson right in this hypothesis? And I think you'll see from this, it's amazing to me. I'm always amazed by how strong biophilia actually is in our lives. And what's interesting for us at Texas A&M is the earliest real studies in this were done by Roger Ehrlich, who was actually a faculty here at Texas A&M in the 80s. And so he put out this really classic hospital study now where he took a group of patients that had come in for surgery. And post-surgery, they were assigned to either randomly to get a room that had a view of the parking lot or a view of a park. And those with the view of the park recovered faster, spent less time in hospitals, had less painkillers and less post-op complications. So that's just a view through a window that he saw that really amazing stuff. And so that drives a lot of our research today as we kind of think through and try to dig down on that. And some of the stuff you can see from the research is that we're really still trying to figure out, and I think this is a great graph, is what dose of nature do we need? And we know nature's good for us. We get that stress reduction in 20 to 30 minutes. So that's pretty quick, that little walk out in nature, the break in nature, that sort of time. We need about 30 minutes or more a week in nature to reduce symptoms of depression and decrease blood pressure. A garden visit a week with up to 4 to 5 a week can reduce symptoms of depression. And then this paper in Scientific Reports, which I'll show on the next slide, shows a change in well-being with about 120 minutes a week. What's interesting is we actually do not have a national recommendation for how much time people should spend in nature. And so here, this paper, this is published in Nature a couple of years ago. You can see there's a significant increase in health at about that 120 minutes. This is self-report. And so just trying to understand, how much time do people spend in nature? For whom? Do children need different guidelines than adults? With physical activity, kids are recommended to get an hour a day of physical activity. Adults is 150 minutes a week. And so we don't even know that yet. So there's so many questions in nature that we're trying to answer these days. And we have, though, seen that connection with nature is linked to longer, healthier lives. So spending time in parks and trails and urban environments can improve mental and physical health. And then there are these much bigger effects of what I call macro nature. So I kind of look at micro and macro nature. Micro gives us changes in mood, well-being, blood pressure. Macro gives us changes in things like our immune functioning. So Howie Frumkin, who's a member of the center, put this paper out right before we started, right? So he looked at sort of saying, what are all the benefits that we get from spending time in nature? Reduce stress, better sleep, improved mental health, greater happiness, well-being, life satisfaction, reduced aggression, reduced ADHD, increased prosocial behavior and social connection, improved immune function, improved overall general health, lower blood pressure, improved post-op recovery, improved birth outcomes, improved congestive heart failure, improved child development, improved pain control, reduced obesity, reduced diabetes, better eyesight, and reduced mortality. I can tell you there are not many things in this world that can have that kind of beneficial effect on our lives, right? So really, really amazing. So this kind of brings us up to where we were when we started the center. So this is 2017. Our center started in 2018. And we said, okay, this is what we know. We don't have any kind of guidelines. We know it's good for you. Let's try and figure this out. And so here are actual from our center. So I'm broken this into kind of different buckets that we look at and trying to figure out. So I'm going to start at the nature and health at the community level. And one of the first projects we did was looking at the Bayou Greenway. Really neat project in Houston. 3,000 acre, $220 million public-private partnership. Put 150 miles of trail on the Bayou system. So really good picture there. The Bayou Greenways is they tend to be in spaces where, if you're not familiar with Houston, we have bayous all over the city. And there's some undeveloped space where you can actually build trail that is away from cars and away from traffic lights. And so the safety issues that we often have with putting in bike walk trails are gone with the Bayou Greenway. And you can commute all the way into downtown Houston without ever, coming into a car or traffic light. So it's really amazing. And so our first question that started back around 2010 was, do these improve health? Does access to these beautiful bayou areas actually improve human health? And so we went out and we went through Houston and took all the zip codes with 30% or more of the population living within a 10-minute walk of the trail. And we took the Texas inpatient hospital data. And we said, okay, here it is. Here's everybody who was hospitalized in these zip codes. And we're going to follow them from 2010 to 2020. And 2019. We finished it purposely before COVID. We found a 93% reduction in obesity-related admissions, 77% reduction in ischemic heart disease, and 71% reduction in heart attack admissions. huge effects. And that Bridget Simon-Freet led that paper. But wow, that was one of our first papers, and we were just like, whoa, what a great investment from the city of Houston, Houston Parks Board, and everyone who was involved in this, and actually improving the health of Houstonians by giving them access to nature. So that was our first study, and we were like, okay, now we're geeked out. Like, this seems amazing. So the next study, we partnered with a group that does two apps, and you can download these for free. This group is out of the University of Oregon, Oregon Health Sciences, and it's called Nature Quant. And so they did this thing where they provided nature scores for every zip code in America, right? So you can go anywhere in the country, you can type in your own area, your address, it'll give you your nature score. And it compares this satellite stuff with pollution, GIS, some computer vision, land and vegetation, everything you could think of to put in nature, and you get this nature score. So here is Houston Methodist in 6565 Fannin Street. And for those of you who've been in the middle of the Texas Medical Center, know, not super green, right? So 50.4 is the score. It's nature adequate. It's not terrible, but it's not, as green as we'd like. If we move over just a little bit, and we go to Herman Park, right? Herman Park, beautiful. Our nature score jumps to 77.5. No, I mean, they're not that far away. So you can actually change your nature score. This really is the real kind of micro look at neighborhood level greenness, or even just moving, Texas Medical Center to Herman Park, neighborhood to neighborhood, even though they're adjacent. And so really cool stuff there. And then you can actually get your nature dose on your phone. You can download this app for free, and it'll tell you how much time you spend in nature, right? So we were interested. We were saying, okay, if we've got nature score, I wonder how that affects health, right? I mean, really, kind of fundamental question. So we went and we got 1,169 urban zip codes in Texas, pretty much every single urban zip code in Texas. So we've got Houston, and we've got Austin, and we've got El Paso, and we've got McAllen, and we've got the Dallas Metroplex. And we took every outpatient hospital encounter, or doctor's encounter. So if you go to the doctor for any kind of mental health issue, right, it gets coded and it gets charged for. So we have a really good thing. So it's 61 million patient encounters. And we broke up the zip codes, and we looked at three things. We looked at anxiety, depression, and bipolar disorder. And we looked at the different levels of nature score. And if you do the QR code, you can get the full paper here. But this is cool. Let me show you this. This is what happened. The first box is the nature deficient, so the almost no nature. Then you had nature adequate, nature rich, and nature utopia. And as you can see, huge number of mental health visits in nature deficit, dropping nature adequate, and then kind of flattens out a nature rich and nature utopia. For anxiety and stress, you saw even a higher level in nature adequate, but then a big drop with rich and utopia. And then depression, it's the highest in the low group, and then again for bipolar. And then we controlled for socioeconomic status, for race, ethnicity, etc., and it still holds up. So what we found was that high nature neighborhoods controlling for socioeconomic status have less mental health utilization. And so not only can we save the state a lot of money, and for treating this, we can actually make people's lives a lot better, right? I mean, it's amazing to think you're less likely to be depressed, have anxiety, or be bipolar if you live in a nature-rich area. So super cool finding. We published that just earlier this year. This is a couple years ago, but I think it's interesting because it starts building into these neighborhoods. And there's a study that I did with Myron Floyd, who's at North Carolina State. And we looked at leisure time, physical activity in parks in diverse communities. And we went to Chicago and into Tampa, and we looked in neighborhoods that were predominantly Black, predominantly Hispanic, or predominantly white. And we measured the physical activity in each of those areas. And I was mostly doing physical activity research at the time. It was physical activity grant. And that first picture was one of Chicago. Here's one of Tampa. We found that 70% of the population in Tampa was sedentary compared to 51% in Chicago. So physical activity lens, right? That's what I was thinking of at the time. Publish a paper on physical activity. And then a couple of years ago, I had a chance to go to China. Actually, for years, I was a visiting professor at Wuhan University. Worked with everybody in public health in Wuhan and would tell everybody that it's this giant city in China that you've never heard of. Can't say that anymore, very sadly, but definitely had a lot of insight when COVID broke out because I knew everyone working in public health there. But this is actually a city not too far, maybe an hour from Nanchang, from an hour from Wuhan, called Nanchang. And we went there, same size as Chicago, same number of parks. And I said, okay, my Mandarin's not very good. Let's use the same methods that we used in Chicago and Tampa, and let's measure the physical activity in parks. And we found something that was astounding to me. In the same number of observations during the same season, early summer, we found 75,000 people in the parks in Nanchang compared to 5,000 in Chicago. And while I was thinking originally about this as physical activity, it really became clear it was access to nature, is that people in China were accessing parks at a tremendously higher level. And what's even more interesting is that more than half of the users in parks in China were older adults, compared to less than 10% in any study that's been done in the US. And so that really got into my head, and I was like, there's something here, and it's something I really want to try to understand better. And if you look at the picture there, that's a typical Chinese park, and it's beautiful, right? It doesn't look like most parks in the US. If you think about most community parks in the US, right? It's this idea of, it kind of came through in the 1900s, of building parks for children, right? We build parks that have playgrounds, that have basketball courts, that might have tennis courts, but that are not kind of leisurely, relaxing areas with water features. And outside of Boston Common and Central Park in New York, we really don't have those anymore. And so it brought the question of the way we design parks, and does that design for certain users and exclude other users? All right, we're going to turn our attention a little bit now to looking at psychology and time spent in nature. I'm a psychologist, and so part of it is, how do we get more people into natural environments? Can we change people's psychology or help them to spend more time? And so we use a theory called the social cognitive theory. And this really says that human beings interact with their environments, and we need to affect their personal factors, their knowledge, their expectations of what happens in that environment, and their attitudes, along with their behavior, their skills, their practice, their self-efficacy or confidence. And then in the environment, looking at social norms, access, which is huge, and then the influence on others, your ability to change your own environment. So that's the social cognitive theory. So we developed this measure of self-efficacy and intention to spend time in nature. We've also developed another one looking at attitudes towards nature. And we were interested in, kind of, when you do attitudes, there tends to be pros and positive attitudes and negative attitudes. So here are all the great things about spending time in nature. I'm relaxed, I have better mood, etc. The negative things, I could be doing more important things, that it's too hot, etc. What we found when we dug into the negative attitudes, we actually had two factors, and we got a second factor that was fear. And it was saying a lot of things like, I'm afraid of wild animals. I'm afraid of bugs. I'm afraid there's not going to be a bathroom if I go into nature. And that was really interesting. As we thought through it, we really started to think about, does early childhood experiences affect the time you spend in nature as an adult? Because if you're been in nature, you grew up in nature, and you're confident in nature, you're going to have a lot less of these fears, which a lot of adults are saying is a big problem with their time spent in nature. And so we just published this paper in the American Journal of Preventive Medicine, looking at influences of outdoor experiences during childhood on time spent as an adult. And so we asked people, what did you do? How often did you do this up to about age 12? How often did you, play outside? How often did you go camping, hunting, fishing, etc.? And we broke it into what we called domestic nature experiences and wild nature experiences. And domestic was that I'm riding my bike, I'm playing in the grass, I'm with friends unsupervised outside. Wild was camping, hunting, fishing, a lot of the stuff that we love here in Texas. And what we found was that the wild experiences was a better predictor of the amount of time that you spent in nature as an adult. And if you can think about the fear and the skill building, you see why that's so important, right? Do we have the skills that we need to be able to spend the time in nature as an adult? And so really interesting, I think, for everyone here that's tied up with the Texas Children in Nature Network, that time that we get kids to spend in nature is going to pay off for the rest of their lives. And I think that's a pretty amazing finding, especially if it's wild time. This is one where we have a grant under review. It's not funded yet, but we've got our fingers crossed, and I think it's super cool. We're working with a group for this indigo development in Fort Bend County. So Fort Bend County, of course, is the Sugarland area. So we're kind of looking south of Houston, and they're building something that they call an agri-hood, which I'm like, that's the coolest name. And I read this report. I'm like, we need to work with these guys. What they're doing is they're building a community around a farm. And so you've got the farm in the center of the community. Instead of putting in a pool, they're putting in a lake so people can swim in a natural environment. They've got walking trails throughout there. They've got farmers markets. And I'm like, if I want to know what happens when people move to this community, does that change the way they think about the world? Does it increase their physical activity? Does it improve their nutrition? And does it increase their time in nature? So we've written a grant to the NIH, their rapid response, and we should hear back in the next month or so if that's funded. I hope it is, because I think that should be one of the coolest things we got to do. We partnered with Renee Olmsted-Meyer at Baylor, and I think our Baylor A&M team is fantastic. So we're really hoping we get to do this, because these guys are great, and this could be the new model of way we build communities, which would be amazing. Howie Frumkin and I published this expert review just a couple of months ago right now, looking at physical activity in natural environments. And so we were really, curious about, do you get benefits? Is it good to exercise outdoors? And from this, I've called it the Reese's Peanut Butter Cup of health promotion. Is that if you think about the old Reese's Peanut Butter Cup commercials where somebody would stick their chocolate in someone else's peanut butter, which probably pre-COVID or post-COVID we'll never do again, or never should in the first place. But you get the benefits of both, which I think is really amazing, right? Time is one of the biggest limiting factors for people doing positive health promotion behaviors, and being active outdoors lets us do more. And people, especially kids, right? For this group, I think is really important. Kids are much more active when they're outdoors. You put a kids at recess in the gym, you put them at recess out in a playground or a park, and they're way more active in the natural environment. We looked at the access to park and trail use, huge predictor, and this idea of nature prescriptions. And nature prescriptions really is a way we can foster spending more time in nature and being active. All right, now we're going to turn our lens a little bit to college nature studies. Obviously, I work here at Texas A&M, and so this is important and near and dear to my heart. So green spaces on or around college campuses have increased quality of life for students. A lot of students choose where they go to college based on the greenery around there, and it really does seem to support physical and mental health by reducing stress, improving mood, encouraging physical activity, and boosting academic performance. And it offers opportunities for outdoor learning and play as a pivotal role in those college years. And so my doc student, she's graduating now, she's Dr. Whitley McGill. She looked at photo voice. So I teach a class every spring in public health communications. And so we did this thing called photo voice, which pretty much was said, we told students, go take a picture, and we want you to take one picture indoors and one picture outdoors, and then you're going to tell us about them. Very simple, right? We didn't tell them take it where you're happy. We always said take one indoor, one outdoor. We wanted to see if outdoor photographs elicit more positive emotion and perceived health than indoor photographs, and what the students' perception of their emotional, mental, physical, and social health was where these photographs were taken. And what's your knowledge of the spaces that campus green space provide? And so here's some of the indoor versus outdoor. And it's interesting. We were not totally surprised, but a little bit that you can see the indoor ones are on the top, and how many of the indoor ones actually captured natural elements. So we've got a fish tank in there, we've got a green indoor, and then outdoor, we just got the most gorgeous photos. And so we took these to class and we said, okay, let's start rating how we feel about them. And I'm not going to get into all this data. It's way too much data. But what we saw is that compared to the indoor photos, they felt more positive emotional, physical, and mental health. They saw real strong relaxation effects and effects of awe and energy, clearing your mind, forgetting your troubles, and feel healthier. And so really strong effects about being outdoors, taking photos in nature as a positive effect. And this is more of it. But we were surprised, and they weren't uncomfortable. They were disagreed that they were anxious or angry. They felt really positive. And so overwhelming, both the outdoor photos and the indoor ones of nature made our students feel a lot better. And this is the first time that, we've seen this kind of a large photo voice study. Over 100 students participated in this. I put too many slides in there. This is one that Maddock student Yan Yan Chen is helping with. In 2023, we launched an online survey of 10 college campuses to really look at the effect of health and well-being in green space, so mental health and access to green space in college campuses. We've looked at a variety of other things, including food security, psychological well-being, physical activity, sleep quality, and how often the students spend in those environments. And we're looking at their attitude towards nature, their sense of connectedness to the natural world, and intention to spend time in these surroundings. We don't have the data yet. We just finished collecting it. You can see on this slide, obviously we did it here at A&M, University of South Carolina, Colorado State. 10 total universities now have collected data. So that is forthcoming. And next time I do one of these talks, we'll have results on that. But we're super excited about that. I think just an amazing opportunity. And it's so important. We're seeing this explosion, unfortunately, of poor mental health in our college students. And if we can combat some of that with green space, it could really have a profound effect. We don't have enough counselors to go around, I think, at any of our universities. And so we're trying in ways that are prevention. I want to talk a little bit about nature prescriptions. And so the idea here is really how do we either use healthcare providers or park and rec workers to prescribe time in natural environments. So another one of Whitley's dissertation studies was to look at healthcare provider prescribed nature. And you can see this is a variety of them, and it's so interesting. It's all over the place right now. This is the thing that's in its infancy, but we have a variety from your traditional physician prescribed, going to your park, to providing nature-based therapy, being creative in green space, doing community gardens, river trips, surfing sessions, sailing voyages. It's neat. It's hard to put these things together because there is so many different things that are happening right now. But I think, just amazing what's going on. And we're trying to learn more and more about what does a nature prescription look like? How does it work? How does it make a difference? So she found, a variety of studies here, both in children and adults, about half and half, which was really cool. And as I said, things from like gardening and park visitation and water-based physical activity really came in. And what's neat is 10 of the 12 studies positively impacted their outcomes. And so we see that all 7 target outcomes were achieved, and there were only 2 studies that didn't see a relationship. And about half of the studies came out of the US, mostly in California, right? So half of them came in California, 2 North Carolina, 1 in Utah. most of them in Western countries too, so 4 in the UK, 1 in Denmark, and then just 1 in Asia out of Singapore. But something that we're really interested in is how do we get better evidence around PARC prescriptions, and how do we make this as effective as possible? So on that, we partnered with PARC America to look at what do their nature prescriptions look like, and what do the people that are prescribing nature through PARC America look like. And so this is their website. If you go through that, you can register as a provider, and you prescribe the place, the activity, the frequency, and duration, right? And looks just like a regular prescription, but it's a nature prescription, and fairly easy to write. And so what we did is we said, okay, let's survey all of the people that you have had registered with PARC America, and let's try to figure out how this affects, or why that they're not prescribing nature. So we sent a survey out. We had 135 healthcare providers complete our survey, 43 in primary care, 22 in behavioral health, and 25 in allied health. And so I think first, as you start thinking through that, you say, okay, there's already so much diversity that we're getting, people in all different fields prescribing nature, which again is trying to figure, how do we be systematic across that? 49 were satisfied, so we did see some dissatisfaction. So one of the things we looked at, and it was mostly around time. How do we get them to be quicker? And you'll see over on the right hand side, 14% prescribed in less than 5 minutes, 72% in less than 8 minutes. And so that means a large percent of people, it's taking 5 to 8 minutes to prescribe a nature prescription. And that's a long time in a encounter with a physician. And so we're trying to figure out, how do we get it quicker for this population, or can we get more into the administrative staff or other people, because it's hard in the doctor encounter to get that in. 93% did feel that they were effective in changing behavior, which is pretty amazing. Show me a medicine that we think is 93% effective. And the top reasons for prescribing: anxiety, depression, general well-being, physical inactivity, chronic disease, chronic stress, and obesity. We've presented this at a conference. We currently have a manuscript that's under review, but none of this data is published yet, so you guys are getting to see it good and early before other people. The next question we asked, and this is really interesting, is, does nature affect our senses differently? And so if you look back to Roger Ehrlich, and his thing was really looking at the sight through the window and saying, okay, if you look out the window, that has an effect, and sight seems to be the strongest one. And so we were starting to say, okay, well, what about the other things? Does hearing make a difference? Does smell make a difference? Does touch make a difference? Does taste make a difference? It's got fruits and vegetables. And so in this study, and this is a study that Saryu Chandramouli, Maddock student, led as part of her dissertation. We brought people into the human behavior lab. And so my friend Marco runs this lab. It's the coolest thing. It's a behavioral economics laboratory. And we assigned people to one of two conditions. They either got a condition where all of the windows were open, and you could see it's a park-like setting around where he is. It's beautiful. There's a pond, there's trees, gorgeous. Or we pulled all the curtains. Pulled all the curtains like you get in a lot of offices. That was condition one. And then condition two, we actually had a scent machine, a machine that puts off the smell of walk in the woods. And you either got the smell or you got nothing. And so there were 4 groups. There was sight only, there was smell only, there were both, and there was neither, right? So we wanted to see how people performed in 6 validated games. And between each game, they would take a short break, and they'd either get their break in nature or they get their break in a break room that didn't have any nature access. And so, does that make a difference? So these are the results for the sight condition. And you can see here the test. The first one was really just a stress test that we got people stressed out, and we had them do mental math. So we said, okay, what I want you to do is just subtract 7s from a number that I give you. And every time you're wrong, I'm going to mark it down. So if I said 49, you'd say 42, 35, 28. I want you to start with 7,653. As you can tell, that's a really stressful task. And they didn't perform differently on the stressful task. That means they didn't get any questions more right or wrong. But what they did was we actually measured their eye blinks, and eye blinks are a measure of stress. And in the control condition, the average person blinked 28 times a minute. In the sight and the smell condition, they went down to 18 times a minute. So it dramatically reduced stress, even though it didn't make them any more correct. But then you can see the significant stuff here. They were significant on 3 of the 5 other tasks. So they had better attention, better memory, and they were less likely to take risks in the sight condition. And what's interesting here, Cohen's D, which probably most people have never heard of that, but Cohen's D of 0.7 is huge. So there is a huge effect of attention and memory just because the windows were open and you could see the nature around you, right? So incredible. Like, so that got us really, really excited. Then we got the question of, what about smell? And here's the findings for smell. Significant difference in attention, significant difference, improvement in intelligence, reduced risk-taking. And those are all, their smell's a little bit smaller, right, than the sight was for all of those. What's crazy is a huge effect of cheating. Students exposed to the smell of nature were significantly less likely to cheat. And that's amazing, right? And it's a totally different, we didn't see that at all in the side effect. So smell of nature reduces your propensity to cheat. Amazing, right? Like what anything is, as a college professor, I'm like, I'm putting that in for every exam now. We're gonna bring the smell machine into my classroom. So really cool as we start breaking down and try to understand the senses. That's one of the things we're working on in my lab right now. Then we kind of asked them, what about virtual nature, right? We know real nature is great for you, but what do we know about virtual nature? What does that show to us? And so this is the first study a couple of years ago, and this was a group that we funded at Houston Methodist, Ashley Barowitz and Renee Stubbins in the group. They looked at patients coming in with oncology patients coming in for their infusions, right? Not a wonderful time to come in for your infusion. And this was a crossover study. So they brought in 33 patients. And so when crossover means they got all 3 conditions. One condition, you got your normal hospital room, right? White, sterile room, TV, you watch TV. Another condition, biophilia. Fill up the room with plants, right? Wonderful plants, looks great, right? Third condition, you got a VR nature experience. You go and wander and walk through natural experience, right? And what they found was that in both the nature conditions, there was better heart rate, blood pressure, and self-reported stress levels in both of those. And it was too small to see a difference, but patients reported the experience as fun and enjoyable compared to people in the control group. And it was really positive. We unfortunately we haven't been able to do a larger study on this one yet. This is obviously published in 21, it's a few years old, but really says there's something here. And we think that there's really something for virtual reality nature when real nature is not feasible. And so obviously getting your infusion is a time when it's not feasible. My other doc student, Susuya, is looking at the effect of virtual reality walks in nature. So we've set up these city walks, and the cities are identical, except for we filled in a whole bunch of nature. So where you see that basketball court on the top, that is a large city park with multiple trees and kind of area to explore. Versus kind of the more stark urban nature. And so she collected all this data in the spring. We don't have any results yet, but we're looking at heart rate variability, at stress, at mood, and can we actually reduce your mood through this walk through nature? And the idea here is, as much as we all love real nature, there's times when, as one of our participants said, it's 106 degrees today and it's hot here. Today might not be your best day to get out into nature. That virtual nature might be a good adjunct, or if it's pouring rain outside, or if you live in a neighborhood that's unsafe and the days are short and it's dark already. So we're looking at this as an adjunctive therapy for real nature. And then we just want to finish up talking about a few programs that we can use to get people into nature, right? It's wonderful to have the research, but I think we also want to make sure our center's helping folks get into nature. And so Deb Kelstead, who is one of our center faculty, is over at AgriLife Extension, and she developed this awesome program that's extension educator led called Get Outside, and was launched just in April of this past year with the joint base down in San Antonio, Lackland, and piloted it as a 5-week program. And this program aims to help families boost their health, happiness, and time together by being in nature every day. And it's partnered with state parks. And so you can really have this chance to get out into nature, to get into a state park, to be active. And so this will be moving statewide in the next year or two, where every extension educator will be able to offer this as part of their portfolio, which I think is amazing. Deb's done a really fantastic job on this. Hey, Deb, and Deb's here. And then one that I'm working on, we got a congressional appropriation last year. So Congress actually thought this was important and agreed on it and put money into it, which is amazing. And so this is a program called Military Families Outdoors, and the money goes to starts at the Defense Health Agency, who oversees all of the health for all of our enlisted military members, and then it goes into the National Park Service, who is, their National Park Service, they're amazing, right? And then Blue Star Families is a belonging organization that works with all active duty militaries that fit in and belong in their communities. Wilderness Inquiry does a variety of wilderness trips and things like Canoemobile, which are in communities, and then the Armed Forces YMCA helps with that. And then our Center for Health and Nature is the evaluator for this project, and we're also in charge of the needs assessment and a prescription program. So what we're working towards is that our military wellness clinics across the nation will be able to prescribe nature to enlisted military members and their families, and hopefully connect to these programs. So that's been an absolutely amazing program, and one that's super rewarding. Here back on campus, we have a campus Nature RX chapter. And so this comes out of Cornell and William and Mary, the Campus Nature RX program, but it is a student-run program that students can get involved in and do student-led, student-fun activities to get their fellow students into nature, which I think is super cool. If anybody here is involved with any university in Texas or anywhere in the United States, I'd love to talk to you. It's fairly easy to get a chapter established. We have over 250 members at Texas A&M. We started a year ago, and it just exploded. There's so much of a demand among our students. They do something every single week to get students into nature, which is just awesome. And then there's the aquaponic gardens here that they've been volunteering and working in. For those of you who have not been to the Houston Botanic Gardens, it's amazing. They're good friends of ours. And so we are currently working on a walking tour of the Houston Botanic Gardens. And this is going to provide little 3 to 5 minute videos that talk about different benefits of health and nature. Things like plants providing antioxidants, the health benefits of nature for children with ADHD and ASD, the benefits of nature on mental health, the effects of gardening on cancer patients, and the health benefits of walking in nature. And so we're hoping that's going to launch this fall. And we hope this is a model for botanical gardens throughout the country, that we can offer these short videos to really get people more engaged in the health benefits of spending time in nature. And then we are excited. We're getting closer and closer to launching the Houston Methodist Healing Garden, which is going to go on the new tower that they're building. And so this will be available for therapeutic nature interventions for our patients at Houston Methodist. Also, the patients that are confined to their rooms, they're specifically putting the patient room so they overlook the gardens. And so going back to the beginning of this talk and kind of, talking the talk and walking the walk at Methodist, it's taking those findings from 40 years ago that we've known, and building our hospitals so that our patients can get that access of nature and can get all of the amazing, wonderful benefits of spending time in natural environments. So we're super excited for when that opens up. And I hope I've geeked you out a little bit on this. We have a nationwide Health and Nature Alliance that we kicked off about a year ago. I happen to be the chair of it, which is just such a fun thing for me to get to do. Researchers and practitioners, REI, Cooperative Action Fund, funds us. If you're interested, please scan the QR code or go to our website. We would love to have you as a member. We're brandy new. We opened membership in December. And we're trying to create a movement. REI has come to us and said, we want a movement of health and nature. And obviously, the Texas Children in Nature Alliance is one of our biggest partners in this. And we've worked with the Children in Nature Network nationwide also. So we've been super excited about that. And we'd love to have anybody that's interested join our network. And thank you guys for your time. I hope this has been helpful and at least interesting of some of the work that we've been doing over the last couple of years. So I think we'll open up for questions and I'll stop sharing.
Great. We have our first question from Dr. Conkey. She asks, can these outdoor programs help communities get past generational trauma that is passed down through families? For example, my grandparents were not allowed in the park or that swimming pool due to segregation. So the family doesn't go there. We don't always realize that this is or could be a barrier to outdoor access.
Yes, thank you for that question. And you know, systemic racism has been a problem in this country for a long time, and we are working to try to figure out the best ways to change. We're working with McGregor Park right now in Houston, which is a very multicultural park with a lot of history and really looking at how that fits into the fabric of the community. Certainly everything we do is in that lens of making sure that it's inclusive for everybody. Not that I have like the answer to everything. It's a hard fight, but it's definitely on our minds, something we think about every time we're looking at a nature space. Thank you for that question.
Okay, we have our next one from Rachel. There are so many multi-service residential facilities that have memory care units overlook the parking lot, while assisted living and skilled nursing and independent living have views of plants. How can these effects be studied to make the change?
Yeah, you know, that's a great one. So we actually have a grant, which I didn't even put on this slide because we have so many grants going in right now, but it looks like it's going to be funded, which is using virtual reality nature in dementia patients. And, you know, again, as I said, you know, in the areas where it's tough to get folks outdoors, we're looking at that. And then the other one, which I love, is the indoor courtyard. I think in memory units, having that courtyard and comparing patients that have access to a courtyard that's indoors where they can't wander versus those that have the view of parking lots. And we really, in our pilot data with dementia patients, nature is affecting anxiety and depression in dementia patients. So perfect thing. And I think something that's definitely been on our list and that we're looking at.
Great. Our next one is from Eva. She asks, working on building in a regional active transportation network in the Rio Grande Valley, a river delta, and trying to determine how to best incorporate nature into the system. Do routes need to traverse natural/pristine areas, or should more landscaping be encouraged in urban built environments?
Yeah, that's a big meta question. You know, I think it obviously depends on the local situation and where you can. I mean, landscaping is always good. I think we don't want to destroy pristine environments. And so, you know, that's almost on a case-by-case basis. You get benefits from both from a human side. And one of the things that I don't spend too much time on that talking about, but one of the reasons that we want people to care so much about the health benefits of nature is that we want them to also be advocates of conservation. And that's why Texan by Nature is involved in this, is that we really do care a lot about conservation and preserving those pristine. So I don't have a perfect answer for that. I think a mix is nice. And certainly landscaping where we don't have wild natural environments can be really positive.
Great. We're waiting for another question to come in, but while we're waiting, I have one for you. Is there anything in the next few years that you see as a possible research topic that has you excited about this work?
Oh my gosh. Yeah, there's so many. I mean, that agrihood to me, I think is super, super interesting because I think it really says, can we design communities in a new way that can connect people to nature? And so for me, I think that's probably the one I'm most excited about because it's real. We're starting to build them, and it's something that, if effective, could have a nationwide impact. So that is probably my most exciting thing right now.
Great. We have one from Kendall. Do you know of any studies or plans to study the effectiveness of policies aimed at better integrating nature into our lives?
That's a good question. I'm trying to, so I will tell you that as part of the Alliance right now, we are working with the National Council of Environmental Legislators, and they pretty much provide staffing for every state legislature that's looking at the environment. And they've asked us exactly for this, for what policies can we do and how can we evaluate them. So there, there's here and there's some stuff, and there's some work at the federal level. There's a recent paper in Science looking at policy at the federal level. But yeah, there's a long way to go on that stuff. And so we're trying to figure that out. We have a policy committee. Love to get anybody involved in that for the Alliance and really what that looks like.
Great. Our next question is from Andrea. She asks, can you talk more about the term wild time outdoors versus domestic outdoors time and where that idea and term comes from?
It's a great question, Andrea. Got Deb on here too, and Deb was the lead author on that paper. But it was a paper that had been published a few years back that had classified people into wild versus domestic time. And so we built off that previous work, but we ran everything into in what's called a factor analysis. And so factor analysis looks at the way the data is spread, and it came out kind of separate between these two. And here's stuff that's kind of out in, more of the pristine nature versus my neighborhood. And so we liked the thing that was, the way they called it. And so we said, okay, we can use that. So it's just the way we chose to name it following earlier conventions. Deb, do you want to add anything to that?
I was going to try to find the citation for you for the original study. I think the authors were the last name of the lead author was Wells, was the person who first coined those two different categories. So I'll find that and I can put that in the chat. But yeah, in writing the paper, we definitely saw this kind of difference in the experiences. And we were like, wait a minute, one of these looks close to home. It looks like stuff that you can do real nearby. And the other looks like something that's happening further away, something that takes a few more skills, as something that maybe takes some adult supervision. So I think there's room to keep expanding on it. This was a real fun paper to write, and one we even presented at the network summit a couple of years ago. So thanks for letting me pop in.
Thanks, Deb.
Great. We're eagerly awaiting our next question, but in the meantime, I put our evaluation in the chat. I'll put it in there again. If y'all wouldn't mind filling that out, that helps us know how we're doing, lets us know, the presenter know how they're doing. Many of us on here are educators, and we know how important evaluation is. And during that spiel, we did get our next question. Megan asks, how can we connect with you in the future to learn about this topic? Would you recommend some podcasts or websites to keep an eye on regarding this matter?
Yeah, that would be great. Actually, Natalia, if you can pop your email in the chat. So Natalia is our project manager for the center. And if you connect with her, we'll add you to our newsletter. We do a quarterly newsletter where we talk about all these things. And then both on the Center for Health and Nature website and on the Alliance website, we keep up with posting news. And we're actually going to have a podcast page on the Alliance website in the next few weeks where we're going to put everybody's nature podcasts and kind of it's the who's who of all the researchers in the country in the Alliance.
Great. I'll also plug, if you're interested, the summit is coming up in December. I know Jay and Deb are presenting at the summit. We have our own, the health has its own category of sessions at the summit. So we are excited about that as well.
We will be leading a kayaking trip in Waco, so sign up quickly because our sessions fill up every year, but it'll be awesome.
Yeah, I think you already are half full.
Yeah. So, register today if you'd like to be in our session.
Yeah, and registration's only been open for 20 days. So, and any last questions? Well, seeing none, thank you again, Jay, for this presentation. We really appreciate it. We will be sharing the recording, and then Jay also said that he would send along a PDF of the slides, so we'll have that in the follow-up email as well. But thank you so much, everyone, for joining us on this hot August afternoon. But we appreciate it so much.
Thank you, everybody.